History hides what power fears. Some events are erased from books, sealed in archives, or rewritten to serve the powerful. But the facts remain. They wait for those who ask the right questions. In this video, you'll uncover 5 events buried beneath official silence. Each one is verified by records, testimonies, and evidence. Each one exposes how far states will go to protect control, profit, or ideology. You will see how governments turned against their own citizens in the name of security, how allies betrayed neighbors for political gain, how vulnerable groups were used as tools in secret experiments, wars, and propaganda. You will hear of massacres denied for decades, revolutions crushed under foreign influence, treaties that shaped the world but erased entire communities. These are not distant stories. They shape borders, economies, and the moral order of the present world. They explain why nations distrust each other, why certain regions remain unstable, and why some wounds never heal. Your task is simple. Listen carefully. Think independently. Decide what these buried truths mean for the story of humanity and for you. In March 1962, during the height of the Cold War, the U.S. Department of Defense drafted a top-secret plan titled Justification for U.S. Military Intervention in Cuba. It was written by the Joint Chiefs of Staff and sent to Defense Secretary Robert McNamara. The plan detailed a shocking proposal: to stage act of terror against American civilians and military targets, then blame them on Fidel Castro's Cuba to justify an invasion. The document listed potential operations. A commercial airliner filled with college students could be shot down and blamed on Cuba. A U.S. ship could be blown up near Havana, similar to the USS Maine incident that started the Spanish-American War. False funerals could be held to stir public outrage. Fake attacks could be staged at Guantanamo Bay to provoke war. The plan even discussed faking casualties, using real or simulated victims to strengthen the narrative. Every member of the Joint Chiefs of Staff signed the proposal. It carried the official approval of the U.S. military's top brass. The only obstacle was President John F. Kennedy. He reviewed the plan and rejected it completely, calling it dangerous and unethical. 1 year later, Kennedy was assassinated in Dallas under circumstances still debated today. Decades later, the document was declassified under the Freedom of Information Act. Its contents confirmed that the plan was not theory or rumor, but a real proposal from the highest level of U.S. military command. In March 1962, during the height of the Cold War, the U.S. Department of Defense drafted a top-secret plan titled Justification for U.S. Military Intervention in Cuba. It was written by the Joint Chiefs of Staff and sent to Defense Secretary Robert McNamara. The plan detailed a shocking proposal: to stage act of terror against American civilians and military targets, then blame them on Fidel Castro's Cuba to justify an invasion. The document listed potential operations. A commercial airliner filled with college students could be shot down and blamed on Cuba. A U.S. ship could be blown up near Havana, similar to the USS Maine incident that started the Spanish-American War. False funerals could be held to stir public outrage. Fake attacks could be staged at Guantanamo Bay to provoke war. The plan even discussed faking casualties, using real or simulated victims to strengthen the narrative. Every member of the Joint Chiefs of Staff signed the proposal. It carried the official approval of the U.S. military's top brass. The only obstacle was President John F. Kennedy. He reviewed the plan and rejected it completely, calling it dangerous and unethical. 1 year later, Kennedy was assassinated in Dallas under circumstances still debated today. Decades later, the document was declassified under the Freedom of Information Act. Its contents confirmed that the plan was not theory or rumor, but a real proposal from the highest level of U.S. military command. Between 1946 and 1948, U.S. public health officials carried out a covert experiment in Guatemala. It was disguised as medical research, but designed as human experimentation. American doctors, working with Guatemalan health authorities, intentionally infected people with sexually transmitted diseases like syphilis, gonorrhea, and chancroid, without their knowledge or consent. The subjects were not volunteers. They were prisoners, soldiers, mental hospital patients, sex workers, and orphans. Many were poor and vulnerable. Ages range from children as young as 10 to elderly adults in their 70s. Researchers infected them through several methods. Some were injected with contaminated fluids. Some were forced into sexual contact with infected partners. Others had infectious material rubbed into open wounds or scratched into their skin. These were not accidents or medical errors. They were deliberate procedures done under supervision. In total, over 5,500 people were used in the study. Around 1,300 were intentionally infected. The stated goal was to test whether new drugs like penicillin or orvismiflozin could prevent infection or stop the progression of disease. But the experiment produced no useful scientific results. It left only pain and loss. The operation was authorized by the U.S. Public Health Service and funded by the National Institutes of Health. Key personnel included the same doctors who ran the Tuskegee syphilis study in Alabama, another case where Black Americans were left untreated for decades. For more than 60 years, the Guatemalan study was hidden. It came to light only in 2010 when historian Susan Reverby uncovered the records. That year, the U.S. government issued a formal apology to Guatemala. President Obama called the acts reprehensible, yet no one was prosecuted. No compensation was given. Many victims had died long before the world learned what happened. This was not science. It was state-sponsored human experimentation conducted on the powerless. It proved how far governments were willing to go when ethics were seen as expendable. In October 1966, the U.S. Department of Defense launched Project 100,000 under Secretary of Defense Robert McNamara. It was presented as part of President Lyndon Johnson's Great Society agenda. The public explanation was that the program would give underprivileged Americans a second chance through military service. In reality, it became one of the most cynical recruitment policies in modern military history. Project 100,000 lowered enlistment standards across the board. Men who had previously been classified as unfit for service due to low IQ, illiteracy, or physical and mental disabilities were now accepted. Some had reading levels below third grade. Others had significant cognitive or health impairments. They were called New Standards Men. Officials claimed the military would train them up and integrate them into society. Between 320,000 and 354,000 men were drafted under this program. About half were sent overseas. A large number served directly in Vietnam. These men were often placed in combat roles despite their lack of preparation, education, or psychological readiness. The results were devastating. Estimates show at least 5,478 of these recruits were killed, giving a fatality rate roughly 3 times higher than regular soldiers. Many others returned home wounded or traumatized. Few received meaningful rehabilitation or support. The majority of Project 100,000 recruits came from poor, rural, and minority backgrounds. Many were African American or from working-class white families who trusted government promises of opportunity and education. Instead, they were sent to the front lines as expendable manpower. After the war, their struggles continued. Most faced high unemployment, low income, poor health, and higher divorce rates. The education and job benefits promised to them were either minimal or denied through bureaucratic neglect. Historians later described Project 100,000 as a social experiment disguised as reform, designed to fill manpower gaps in Vietnam while claiming to fight poverty at home. It became an example of how policy can manipulate the weak under the language of opportunity. In 1943, Bengal, then part of British India, suffered one of the deadliest famines in modern history. An estimated 3 million people died from starvation, disease, and malnutrition. Villages collapsed. Families sold children to survive. Corpses lined railway stations and roads. Yet this was not a famine caused by nature. It was engineered by wartime policy and administrative neglect. The harvest that year was not catastrophic. Rice yields were adequate. There was enough food in India to prevent mass starvation, but the people of Bengal could not access it. Prices soared beyond reach. Grain was hoarded by traders. Government control of transport and distribution crippled local markets. Ships and rail were diverted to support British troops in World War II. British authorities prioritized feeding soldiers, maintaining stockpiles, and supporting the war front in Europe and the Middle East. Relief shipments to Bengal were repeatedly denied. When Indian officials pleaded for grain imports, Prime Minister Winston Churchill refused. He wrote that the famine was a fault of the Indians themselves, saying they breed like rabbits. Meanwhile, Bengal continued to export rice even as people starved in the streets. Local administrators tried to downplay reports of hunger to protect imperial image and maintain morale. Newspapers were censored. Aid was delayed for months. A 2019 study confirmed that this famine, unlike others, was not caused by drought or crop failure. Soil moisture and rainfall were above normal. The cause was economic isolation and policy-driven scarcity. Food was available but locked behind colonial priorities. When aid finally arrived, it was too late. The victims were mostly poor farmers, laborers, and women. Epidemics of cholera, malaria, and dysentery swept through refugee camps. Mass graves were dug across Bengal. The event scarred India's collective memory, though it was downplayed in British history for decades. Winston Churchill is still celebrated as a wartime hero in the West. In Bengal, he is remembered differently, as the man whose policies starved millions. You have just witnessed 5 events where those in power targeted citizens, workers, vulnerable groups, and entire populations. Each case leaves a lasting mark. Trauma passed through generations erase your voices and questions that remain unanswered. History is never neutral. What gets written, preserved, or taught depends on who controls the records, who has the authority to interpret events, and whose stories are deemed important. Many truths are buried, many witnesses silenced, many documents hidden. What you have seen is only a fragment. It shows that official accounts are incomplete and often shaped to protect power rather than reflect reality. Now it is your turn to look deeper. What other events have been erased from textbooks? Whose suffering is invisible in archives? What truths are waiting to be uncovered if someone dares to search?